This is 9 News Now.
Imagine having epileptic seizures and never knowing when they could hit. According to the World Health Organization, it's a reality for nearly 50 million people around the world.
And in tonight's Health Alert, Anita Brickman explains why doctors now want more people with uncontrolled seizures to think about having brain surgery.
I have had epilepsy since my young age of 2.
Michael Beitel of Boonesboro, Maryland, lived with epilepsy through his entire life. He was able to cope with the occasional seizures most of the time, until one day it started affecting his job.
I had literally fell. I'd never fallen before during a seizure.
Was your employer saying you need to get this fixed to come back to work?
Not necessarily fixed. They just wanted a clear bill of health.
His seizures kept getting worse, as they tend to do as patients age. Doctors tried several different medications to bring them under control, but it didn't work. This made Michael a candidate for an operation in which a small part of the temporal lobe section of the brain is taken out. That's where the majority of epileptic seizures originate.
There's an average delay for our patients of about 22 years before they are referred on to a center like ours.
Dr. Chris Kalhorn of MedStar Georgetown University Hospital says one of the main reasons for the delay is because many candidates for this procedure are reluctant to undergo brain surgery. It was once rumored that the risks were not worth taking, but a recent study in the Journal of the American Medical Association dispels that notion.
And what this study showed very elegantly is that of the 23 people who were just taking medication alone, all 23 of those patients were still having seizures. And if you looked at the temporal lobectomy group, 11 of the 15 of those patients were seizure-free.
Michael had his procedure in 2005 and is now seizure-free. And for the first time in his life, he doesn't have to worry about his epilepsy at any given time.
How many seizures have you had since your operation?
Since 2005, I have been great. Life has been full.
Anita Brickman, 9 News Now.
Oh, I'm happy for that fella. Now, Dr. Kalhorn says temporal lobectomy is very safe with high-resolution MRI imaging, and the risk profile is comparable to many commonly performed procedures.